Grace.
Hi, everyone. So yes, as Adam said, I'm Grace Hillman and I'm the US Key Account Executive for Trimedika. So I have a presentation just around sustainability that I'll pull up now and run through some slides, and then we can have a bit of a discussion.
Thank you so much, Grace. And as always, any questions whilst Grace is talking, please feel free to pop them into the chat. We can bring them up at the end of Grace's presentation.
No worries. So can everyone see my screen? Yes?
We can. I think you just need to hit start slideshow.
Sorry, I just can't see the top of my thing. One moment.
F5 as well, if you hit F5. Yeah, there you go.
Perfect.
I'm not as
Fabulous.
technically versed as I would like. So today I'm going to be speaking about how can the health tech industry become a pioneer when it comes to sustainability. So Trimedika, a bit about Trimedika. We are a UK-based manufacturer of innovative medical devices. We were founded in Belfast in 2016, and we specialize in products for hospitals. All of our designs are nurse-led, and we're responsive to market needs. We've got distributors in 22 countries, and we're CE marked and ISO accredited. So I've just got a quick video showing the demand and the necessity for sustainability within healthcare, and that I'm going to play now.
We have to do what's in our power. We can't take that as an excuse for doing nothing. We must do everything that all of us can do and must do.
So just going on to the problem. So the global healthcare industry is responsible for 2 gigatons of carbon dioxide each year, or 4.4 of worldwide net emissions, the equivalent of 514 coal-fired power plants. So if the global healthcare sector were a country, it would be the world's 5th largest emitter of greenhouse gases, which kind of gives you an indication of just how much pollution healthcare accounts for. So supply chain impact, decarbonizing the healthcare supply chain. Suppliers and manufacturers should decarbonize their operations and products. Much of the 71% of healthcare scope 3 emissions are emitted in the global supply chain. The transition to low carbon or decarbonized healthcare will require moving global production of healthcare products, everything from pharmaceuticals to medical devices, from food to clothing, onto a zero emissions trajectory. So how can health tech contribute to sustainability? One would be design for manufacture, so quality of manufacture, build to last, reduce breakages, reduce costs, and reduce plastics. Low energy devices to reduce energy needs and battery replacement. And design non-waste generating devices to reduce plastic consumables and cost. Developing non-contact technology, which can reduce infections, reduce plastics, and improve patient experiences. So the NHS and the circular economy. So the latest RAP figures state that 3.7 million tonnes of plastic are thrown away in the UK each year, with 32% recycled and 30% littered. Plastic has historically been a safe and cheap alternative to plastic, glass, or cardboard for many companies. And with our National Health Service, single-use plastics have been vital to maintaining a sterile environment for both patients and also NHS professionals. But with the ever-growing threat of our demising environment, public awareness of plastic pollution is igniting a want for change. So in the journey towards a circular economy, we're seeing increasing levels of new and innovative products and services being introduced across the breadth of the NHS to help tackle our plastic problem. From reusable products and recycling systems to choosing plastic products with a lesser carbon footprint, we can make a change with the NHS to help promote a circular future. So then just following on from how can health tech contribute to sustainability, the health and wellness piece. So technologies for efficient delivery of care, reducing cleaning, will give back time to our nurses, and non-wasting generated devices. So reducing waste at the nurses' station, which will reduce infection risk. Develop devices in collaboration with healthcare teams that are fit for purpose. Develop devices that are less disruptive for patients, which will make their life more comfortable and lead to faster patient recovery. Online access to information and training to reduce packaging and training literature. Design connected devices for efficient transfer of patient data and accessibility. And build easy to use devices, which will enable community care and care at home. So the plastic problem, so many medical procedures will require plastic use, such as surgical interventions. However, focusing on where plastics can be eliminated, one focus would be routine, frequent use devices, which accumulate plastic consumables, such as thermometers, which use up to 10,000 plastic probe covers per device per year. Use more climate-friendly plastics. Consider reusable devices and recyclable consumables. And review manufacturing processes for a greener solution. So these are just some of our pain points for sustainability officers. So looking at their increasing volumes of plastic waste, pressure to get to net zero, and budget constraints. So the sustainability officers, their objectives would really be, since the beginning of COVID, the amount of plastic waste generated by the hospital has skyrocketed. So our response to that would be that Tritemp's non-contact technology allows hospitals to minimize infected plastic waste, while at the same time eliminating the need for millions of unnecessary contact points and infection risks every year. Another one would be we're under pressure to get to net zero with regards to our CO2 emissions. So Tritemp understands that hospitals cannot function without the use of single-use plastics. However, non-contact devices and technologies offer the opportunity to minimize single-use plastics on a massive scale, thereby helping you meet your CO2 emission targets. And we need to find new ways of providing optimal, sustainable healthcare solutions, which will enable to reduce our environmental footprint. So our response to that one would be that Tritemp is a non-contact technology, robust design. We have a 0.5 breakage rate, which really plays into your sustainability piece because there are a lot less replacements required. And then, of course, the last one, staff are getting frustrated at the increased cleaning measures that have been introduced. We're using large volumes of non-eco-friendly chemicals. So Tritemp is a non-contact and it does not need disinfected between patients. It's a simple alcohol wipe. So Tritemp can help meet carbon reduction targets. And it's also important to note that 4.4% of greenhouse gas emissions across the globe come from hospitals, which is crazy. So helping you meet your carbon reduction target, the NHS creates 133 tons of plastic per year, and only 5% of that is recycled. So around about 1,000-bed trust uses the equivalent volume of a double-decker bus every year. Whereas Tritemp is a non-waste generating device. We use no plastic probe covers, and it's also a low energy device with about 40,000 readings on 2 AAA batteries. And we can help the NHS fight climate change by eliminating single-use plastics from temperature measurement specifically, which will help them meet their carbon reduction targets. So I'm just going to run you through some of the benefits of TriTemp, our non-contact thermometer, hospital grade. So the first one would be infection control. So about 80% of healthcare acquired infections are spread through contact. So if you eliminate that contact, you're going to eliminate the risk. And the next one would be saving time. So workflow efficiencies. And this isn't just on the front for nurses. This is also looking at engineer time. So a hospital we worked with in Dublin called Bon Secures, we were able to save them about 500 hours just from doing a direct switch from their tympanic, which is the in-the-ear thermometer, to TriTemp, which is non-contact. And also saves costs. So every single contact device uses a plastic probe cover or a plastic sheath, and we eliminate that cost, as well as the disposal cost, as well as the storage cost, and then the sustainability, because we're taking out single-use plastics from healthcare. So what organizations need to do? So they need to become carbon literate. They need to change their organization culture. They need to collaborate and learn from other industries, partner with those who have had success, join with similar companies to achieve your aims, follow a framework to set targets, and follow a framework to disclose on progress. That can also be quite helpful. So health tech can help build a sustainable future. So individual health facilities, health systems, ministries of health, international and bilateral development agencies, and private healthcare organizations can all take action towards this goal, and it can be achieved. Health has responsibility to align its actions and development trajectory with the Paris Agreement. And given its mission to protect and promote health, the sector also has a responsibility to implement the Hippocratic Oath to first, do no harm. If a healthcare development growth and investment can align with global climate goals, the 10% of the world economy that healthcare represents, together with its political influence at every level of government, can help provide leadership for a low carbon, climate smart, more equitable and healthier future. So thank you everyone for listening to my presentation. I've put some contact details on screen now. So if you would like to take a note of them and reach out to me if you have any questions, if you would like to do any follow-up work. But I'll just open the floor up to discussion if anyone has any questions, and stop sharing my screen.
Thank you so much for that, Grace. And I'm just sat here with my pandemic hat on. From during the pandemic, I was a care home manager, and I was the hard work we had to put in to try and find non-contact thermometers during the pandemic was incredible. And the ones that we did get broke constantly. I think we went through about 6 of them. Batteries constantly running out. So this is a fantastic solution, and I just wish I'd have known about it sooner. I mean, I was looking at your slides then, talking about saving time and saving money. It saves space. Not having to store them little plastic caps. Our nurse trolley got constantly full of plastic caps, and if I couldn't have had them, it'd have been neater, it'd have been tidier, there'd have been less stress, it'd have been more enjoyable. I think it's a fantastic solution.
No, it's so amazing to hear that for you, because one thing that happened during COVID was the market was flooded with these cheap non-contacts. So there's a stigma around non-contact thermometers that they are cheap, they have low accuracy points, and they have high breakage rates. But that's one way that Trimedika really differentiates from those devices, because we were about pre-COVID and we are specifically for hospital use. But it's amazing to hear. I might actually have to get a testimonial from you saying that, because that is just exactly what we're all about. Really hearing from the end users and integrating all of your feedback into our product, and how do we make it easier for you to use, training wise, device wise, all around. But does anyone have any questions, or if not, feel free to reach out to me anyway. I'm on email. Or... Are
we okay to share your slides out post conference, Grace?
Yes, of course. Yes, I'll forward them across.
That's fantastic. I mean, we got to the point during the pandemic, we were actually buying meat thermometers, like people would use to sort of scan meat, because there was just nothing around, absolutely nothing around. So I think great solution. And I like the idea of this no contact care for areas where things can become no contact. I think is brilliant. And one thing that comes straight to mind is medication administration. You know, because so much plastic waste goes on within medication administration. I know we have reusable cups, but the amount of people are wearing gloves and the PPE, and there has to be something simple that we can do there to reduce the wastage. So maybe Trimedika could come up with something there as well.
Yeah, well, just wait, there might be something in the pipeline, so you never know.
Oh, there we go. You heard it here first. You heard it here first. Honestly, thank you so much for giving us your time today, Grace. Been an absolute pleasure to have you as part of this conference.